United States. Data from the Centers for Disease Control and Prevention shows that over 4,300 young Americans died of firearm-related injuries in 2020. Now, while suicides contributed to the toll, the data shows that homicides from the majority of gun-related deaths, more than 390 million guns, are owned by US civilians. The research is published in the New England Journal Medicine. Jason Goldstick is Associate Professor of Emergency Medicine at the University of Michigan, part of the university's Institute for Firearm Injury Prevention, and he's one of the authors of the report.
What really stands out is the dramatic change that happened from 2019 to 2020. My colleagues and I have really been following this line of research for some time now. One of the many things that we do at the Institute for Firearm Injury Prevention is to track epidemiological trends in firearm injuries. And in this case, we're updating a report that was written 4 years ago in the New England Journal of Medicine. And we saw, while updating those numbers this year, we saw a dynamic shift in the trajectories of two major causes of death, firearm injuries and drug overdoses. And we thought that called for an update to the previous analysis. You can see in the chart, firearm injuries, which is the focus here, those actually increased by 29.5% in the age 1 to 19 group. There was actually, if you stratify that by homicide and suicide, the increases in homicide was almost 40%, and the increase in suicide was a little bit over 11%.
Why such a steep rise over that period?
This is an analysis of ecological data, so it's not really well suited to identifying causal mechanisms. I mean, what it does tell us is that this is a worsening problem in the United States, and there was apparently a dynamic shift in the trajectory in 2020.
But when you look at the young people and the particular groups of young people caught up in this, does that tell you anything?
Yeah, it does. The older end of that age group, 14 and older or so, that's where a large burden of these injuries is. And also, in the United States, firearm injuries are a major driver of health disparities among kids. So basically, Black kids are much more affected. With public health, one of the goals is to alleviate health disparities, and addressing this problem is one important way to do that.
Research like this is obviously published, it's discussed, we're talking about it on international media. Does anything happen as a result?
I think that something can happen as a result. For example, we've seen in other types of injury prevention, like with motor vehicle deaths, for example, a public health approach was effective at reducing motor vehicle deaths substantially over the last 50 years or so. That was accomplished without banning cars or any of the rhetoric related to the Second Amendment in the United States. In fact, people drive more now than ever, and motor vehicle deaths are lower than they have been in over 50 years. So there's really no reason an analogous approach cannot work for firearm violence. I would say the missing prerequisite to doing that now is the evidence base for what works. And as we actually showed in another paper that was published in Health Affairs a few years back, relative to other leading causes of death among children, firearm injuries have received orders of magnitude less public investment for research. And this is beginning to change now with some recent public research opportunities. So we can leverage those to look at what strategies work. We're hoping that we can try to understand what prevention approaches are actually effective.
Jason Goldstick in Michigan.